In the right side short-axis M-mode view of the left ventricle, you see the anechoic chambers of the right ventricle and the left ventricle. The endocardium is the hyperechoic inner lining of the ventricular chambers. The pericardium is the hyperechoic outer fibrous covering of the heart. The right ventricular free wall is in the near field. The interventricular septum separates the right and left ventricles. The left ventricular free wall is in the far field. Sometimes a papillary muscle of the right ventricle can be seen and must be differentiated from the interventricular septum. Toggling between the two-dimensional view and the M-mode view will help you differentiate papillary muscle from the muscle of the septum. Ideally, the M-mode cursor is placed between the papillary muscles of the left ventricle. The patient's respiration often moves left ventricular papillary muscle into the M-mode cursor line. Papillary muscles of the left ventricle must then be differentiated from the left ventricular posterior wall. Toggling between the two-dimensional view and the M-mode view will help you differentiate between papillary muscle and the muscle of the left ventricular posterior free wall. You can also look at all of the visible left ventricular wall for the most consistent hyperechoic line of the endocardium of the left ventricular wall. Diastole is the period of time when the heart muscle is relaxing and resting. The muscle reaches its thinnest appearance and the left ventricular chamber has filled with 75% of its blood volume. With relatively slow heart rates, it is possible to see a small increase in left ventricular size just before the heart contracts. This point represents left atrial contraction, when the last 25% of blood volume is added to the left ventricle. Systole is the period of time when the heart muscle is contracting. The heart muscle reaches its thickest appearance and the left ventricular chamber achieves its smallest appearance by pushing the blood volume out through the aorta. Note that diastole of the right ventricular free wall, the interventricular septum, and the left ventricular posterior wall is coordinated. They all occur at the same time because of the electrical conduction system of the heart. Systole of the right and left ventricles also occurs at the same time. With a frozen M-mode image, use Cinematic Loop to choose the best image of diastole and systole. Activate the calculations package of your ultrasound machine. Use your trackball or touchpad to select the left ventricular or Teichholz measurements. In most machines, this allows you to make standard measurements of the left and sometimes right ventricle. With these measurements, your machine will also make standard calculations of cardiac function. In cats, begin with a measurement of the right ventricle in diastole. Remember, diastole is relaxation of the ventricles. This is when the right and left ventricular chambers are passively filling with blood. Pressure in the ventricles is at the lowest point, allowing blood to flow from the atria into the ventricles. Place the first cursor on the endocardium of the right ventricular free wall, and the second on the endocardium of the right ventricular side of the septum, at the thinnest part of the muscle walls and the widest point of the right ventricular chamber. Note that I use the left side of the horizontal bar of the calipers to make measurements. In some machines, each measurement must be selected individually and saved as it is made. In other machines, when you select your starting measurement, cursors for each sequential diastolic or systolic measurement are automatically produced. The end point for measuring the right ventricular chamber is also the starting point for measuring the septum, and so on. In some ultrasound machines, all measurements in diastole are saved at the same time. All measurements in systole are also saved at the same time. You need to be familiar with the functions, capabilities, and operations built into your machine. In dogs, there are no standard measurements for right ventricular size. So in dogs, we begin with a measurement of the interventricular septum at its thinnest point by placing calipers on the endocardium of each side of the septum. Do not include right ventricular papillary muscle in the septal measurement. If papillary muscle is present, try to identify and follow the most persistent hyperechoic line of the endocardium to the point you choose to measure. This is followed by a measurement of the left ventricular chamber at its widest point, close to the next muscular contraction. Calipers are placed on the endocardium of the left ventricular side of the septum and the endocardium of the left ventricular posterior wall. Do not include papillary muscle of the left ventricle in your measurement. If left ventricular papillary muscle is present, try to identify and follow the most persistent hyperechoic line of the endocardium to the point you choose to measure. Finally, the left ventricular free wall is measured by placing calipers at the endocardium of the left ventricle and at the outer wall of the left ventricle where it contacts the thick hyperechoic wall of the pericardium. Do not include pericardium in this measurement. Your caliper should be at the interface of the muscle and pericardium. Next, systolic measurements of the septum, left ventricle, and left ventricular free wall are made. Again, avoid including papillary structures in the measurements. Remember, systole is ventricular contraction, and the measurements are made of the muscle walls at their thickest points. The right and left ventricular chambers will be at their smallest sizes. Pressure in the ventricular chambers is at its highest point, forcing the aortic and pulmonary valves open and ejecting blood from the ventricles. Most ultrasound machines allow a calculation of heart rate from M mode. When the M mode image is frozen, select the caliper or measurement function. An option of heart rate can be selected. One caliper can be placed at any point of systole or diastole and set or selected. Then a second caliper is produced and can be placed at the same position of the next heartbeat. The heart rate will be calculated and can be saved to the patient record. In some machines, the second caliper is placed at the same point after 2 heartbeats, and the average heart rate is calculated. This calculates a more accurate heart rate in a patient with a sinus arrhythmia. You need to know how this function operates in your machine. The muscle and chamber measurements are temporarily or permanently stored on the patient report of your machine and can be compared to charts of normal measurements for cats and dogs. Consider muscular hypertrophy if a measurement exceeds normal in diastole or relaxation. Excessive measurements in systole may indicate an excessive contraction rather than muscular hypertrophy. If most measurements are normal but one is not, you should consider operator error, which is common. It is very easy to include papillary muscle in your M mode measurement. You can help to prevent this by comparing the measurement you are about to make to similar points of systole on either side of the heartbeat you are measuring, or consider repeating your M mode left ventricular measurements. Cardiac chamber enlargement indicates a volume overload most commonly seen with a valvular insufficiency. If a valvular insufficiency is significant, the chamber into which blood is leaking will enlarge. It is possible to have a valvular insufficiency that does not cause chamber enlargement and therefore is insignificant. This 7-month-old German Shepherd with aortic insufficiency has a larger than normal left ventricular chamber in diastole, proving that the aortic insufficiency is significant. The patient report shows calculations of ejection fraction and fractional shortening made from your Teichholz measurements. Ejection fraction is a calculation of the percentage of left ventricular volume that is ejected from the left ventricle during systole, but it is valid only at the point where the M mode cursor is placed. Normal ejection fraction for a dog is 60 to 80%, and for a cat is 70 to 90%. Fractional shortening is a calculation of the percentage decrease in left ventricular size between diastole and systole, but it is valid only at the point where the M mode cursor is placed. Fractional shortening for a dog is 28 to 48%, and for a cat it is 39 to 61%. Fractional shortening can be roughly associated with contractility of cardiac muscle, but only for the area of cardiac muscle in contact with the M mode cursor. If contractility at that point is poor due to infarction or ischemia, other cardiac muscle may compensate by overcontracting, and the stroke volume or cardiac output of the heart may not be affected at all. Final diagnosis and treatment recommendations are not based on any one measurement, but should consider the patient's symptoms, blood results, radiographs, ECG results, blood pressure, and ultrasound results. All ultrasound measurements should be considered as guidelines to help evaluate cardiac function and not as absolutes. Teichholz measurements are based on a left ventricle shaped as an ellipse and do not reflect the true size or shape of a human left ventricle, much less a dog or cat.